Good morning, everyone. My name is Maya Luria with TMC for Seniors, and I am happy to have Jennifer Clark here. Jennifer is a physician assistant over at Pima Heart Medical, and she specializes in varicose veins. And we have had Jennifer on before, did a wonderful presentation for us, and really dives into what you can do for varicose veins. So I'm happy that you're back, Jennifer. Thank you for being here today.
Oh, thank you so much for having me again. It's always good to be here.
Yes, so we are running today on our YouTube page along with our Facebook pages. So if you have a question for Jennifer, please leave them in the comments. And once she is finished with her presentation, we'll go through any questions that come in. So I'm going to go ahead and put your presentation up for you, and you should be good to go, Jennifer.
Okay, well, thank you so much. Again, good morning, everybody. I'm really excited to be here again and teach you all about varicose veins. I just really want to kind of dive into really some basic information to help you understand the whole process, and certainly things that we can do to help you if you do have problems with venous disease. So we'll kind of dive right into it. So first of all, I always talk to my patients about understanding what a vein is, because it is so common that patients will mix up veins and arteries when they're having a conversation. So just a pure and simple explanation of the difference between the two. Arteries, what they do is they take blood with oxygen from the heart and lungs to the rest of the body. Okay, so they are muscular and they move that blood by contracting. So when we feel a pulse, right, we're feeling an artery. So once that oxygen gets delivered, then the blood needs to go back up to the heart and lungs again to cycle back through again. And so that's what the veins do. They take blood that needs oxygen back up to the heart and lungs. And so they're a little different than arteries in their structure. Instead of being like this muscular pumping device, they are these tubes with these one-way valves that open and close, and that's how they move the blood back up to the heart and lungs. Okay, next slide. So we have a couple of different types of veins. We have what's called superficial veins, and we have deep veins. Okay. Problems with varicose veins are usually more of a problem of the superficial veins. And the difference between the two, superficial veins, what they do is they kind of collect that blood that needs oxygen and they dump into the deep veins. And the deep veins are the main highway for that blood to get back up to the heart and lungs. So if you've ever heard the term DVT or deep vein thrombosis, that's a problem with a blood clot in the deep vein. Varicose veins, as I said, are more of an issue that we see with the superficial veins. And what can happen is you see this picture, we have a normal healthy vein on the left side of the screen, and then we have a vein that has what we call venous insufficiency or venous reflux, where the vein gets dilated to where those valves that are supposed to open and close, they can't close all the way. So instead of that blood flowing up, it flows backwards, and that can cause all kinds of different things. Next slide. So this is some of the things that we can see and feel when we have this happen. Things that you can see, spider veins. You can get big, bulgy, ropey varicose veins. You can have swelling or skin discoloration. It looks like you have a tan below the knee. That third picture is a really classic example of some of the hyperpigmentation we can see with chronic backwards blood flow. You can get a rash where it's like really kind of itchy. And sometimes in severe cases, we'll even see ulcers. And those ulcers are just these open wounds that we'll see either on the inner ankle or the outer ankle most commonly when it comes to venous disease. So your legs can really hurt you when you have problems with your veins as well. They can feel heavy and tired and achy. I have patients tell me all the time it feels like they are like walking with like cement, posts for legs. Their legs just feel super heavy. They can cramp at night like Charlie horses. And patients will describe that sometimes as their toes kind of drawing up. Restless legs is another really common symptom that's associated with venous disease. And there's a couple ways to describe restless legs. One is they can feel like a creepy crawly sensation and you can't stand it. You got to get up and move around. And another is that the leg actually jerks involuntarily. Also, itching and burning and numbness are pretty common as well. But I always tell people numbness and swelling are two very general symptoms of a lot of different things. Veins certainly can cause that, but it's not necessarily the only reason. So it's kind of important to understand that too. But those are the common things that we see that's associated with this. So next slide. So what causes it? People ask this question all the time. There's a lot of different things that kind of put people at higher risk. Some things you can kind of have impact on and some things you can't. One in particular is genetics. If you have a strong family history of venous problems, you likely will be blessed with that as well. So particularly direct family history like mom, dad, brother, sister. Women are more prone than men for a couple of reasons. Our hormones can take a toll on those veins. And of course, because we have babies, so multiple pregnancies can certainly be a reason for this as well. Things that are a little bit more under our control, weight, inactivity, heavy lifting. Those are all reasons why people can develop this over time. People with standing professions or professions where you sit in one place like a driver, those also tend to have some common association with people who have venous disease. As you get older, of course, you tend to have things not work as well as they used to as well. So obesity is another big reason why we can have problems with our veins. Next slide. So how do you know if you have this? You can have all these symptoms, but the only way that you really are going to be able to tell if you have a vein problem is to get an ultrasound. And you need to get this ultrasound at a place that really specializes in venous disease. If you go to like an urgent care, or some, regular radiology place, they might just look at the deep veins to make sure you don't have a blood clot, which that's an important thing to rule out if you are considering that. But if you really want to understand if you have this venous insufficiency, you have to get an ultrasound that really evaluates both that superficial system and the deep system. So, it's an ultrasound that takes about an hour, and we look at both the deep and the superficial veins, and we basically can see if this problem is going on in your leg and which veins are affected. And certainly from there, we can develop ways that we can recommend treatment for you if that's what's needed. So, and this is usually something that is 100% covered by insurance. It's always best to have a ultrasound tech that specializes in vascular studies to get a really good result. So next slide. So you get the diagnosis. Now the next question I'm sure you have is, well, what do you do about it? So we always recommend a period of conservative treatment first. We do that for a couple of reasons. Number one is it's an insurance requirement. They want to really see that you've tried conservative before they approve any kind of an intervention. And the other reason, and I have a lot of patients that, we get set up with some conservative means and they do really well with that. And, their symptoms are under control. We don't have to jump right into a procedure. And so that's always a really good thing too. So this slide really kind of talks about some different things that we do for conservative treatment. The main thing that we always recommend is compression stockings. So when you look at compression, there's all different kinds out there. The key is really making sure you get the right level of compression. So the bigger the numbers, the higher the strength of compression. I know a lot of people have tried them and they say they're really hard to get on and off, and they can be. But really a medical grade compression stocking is one that's 20 to 30 millimeters of mercury in compression. So you want to look for that on the package. The other thing that I always tell people with compression is to make sure you have the right size. I have a lot of people come in all the time saying, well, I wore my wife's compression or my husband's compression, and they don't fit. So you always have to make sure that you measure. Typically, every compression company has a different sizing chart, so it's always important to look at that chart, but they're looking at the measurement, particularly of the calf and the ankle, and sometimes they'll take into effect the shoe size. So looking at all of those things will help you make the right decision for the right kind of compression. And they have different kinds like zip up. And so there's options out there. So I wouldn't give up if you just had a pair of compression that wasn't comfortable the first time. Sometimes just playing with it a little bit, you can find some that are pretty comfortable. But in addition to compression, there's some homeopathic things that we recommend. I always like to tell patients about a supplement called horse chestnut seed. It has been really well researched as far as how it affects symptoms of venous insufficiency and the heavy, tired, achy feeling that comes with it. That horse chestnut seed really does seem to help with. When it comes to the leg cramps at night, apple cider vinegar patients swear by, as well as tonic water. Tonic water has something called quinine in it, and that helps kind of make those cramps go away. There's also things like leg elevation, over-the-counter pain medication. Of course, exercise and weight loss are really important too. When I talk about exercise, I always talk about calf muscle pump exercise. What that is anything that makes your foot go up and down is flexing that calf muscle. That calf muscle actually works like a pump to pump that blood back up. So the more you fire off that calf muscle, the better that circulation is. So a lot of times I'll have people come in who have had kind of sedentary lifestyle and they start a walking program, or they'll use like a pedal exerciser or something like that, and they find that their symptoms are far less severe by just doing something as simple as going for a walk. So lots of conservative things that we can do as well. So next slide. Sometimes people do all the right things with conservative treatment and they still are pretty miserable with symptoms. And if that's the case, then we have different types of intervention that we offer. And so I'll kind of just talk through those different procedures with you just briefly. Sometimes we have to do multiple different types of procedures for patients. Depending on the vein, and that's really where that ultrasound helps guide us as providers to kind of be able to recommend treatment based off of what we see on that ultrasound. So we'll kind of go through them one by one, and hopefully you'll get just a brief overview of the options that are out there. Next slide. So when we talk about treatment, what we're doing for these superficial veins is when they're not working, they're getting in the way of the ones that are. So what we do is we go in and we close those veins down. And so by doing that, we allow the body to reroute the blood to the healthy veins, and that's what makes everything feel better. And so we have all these different ways of doing that closing. So the first method that we use is this closure fast procedure, which is basically where we put a catheter into the vein, and that catheter heats up and it closes down the walls of that vein. So it uses what we call radiofrequency ablation. So the tip of the catheter is about 7 centimeters, and that segment basically heats and closes the vein. So we position the catheter, and then as we're backing it out, we close the vein down in sections. It takes about 20 minutes and all outpatient. There's a little discomfort with it when we have to numb the vein, but it's a pretty straightforward procedure. Next slide. A newer option, which I tend to prefer because I think it's easier for patients if they're a good candidate for it, is something called a Venousyl ablation. Same concept. We put the catheter into the vein, and as we're backing it out, we close it. But instead of using heat, we are delivering a glue, and that glue actually glues that vein shut. So it's not as painful, and it's a little bit easier for you post-procedure. And so I like this one a lot as well. Both have similar efficacy as far as closure rates, and they're both very, very good options. It's just a matter of coverage and what procedure would be the best for you given your circumstances. Next slide. So Verifin is something sometimes we will do in addition to these procedures. If you have a vein that is really curvy or not, if maybe there's multiple veins that are coming off of the main superficial veins that we need to treat in addition to those, Verifin is a good option for that. When you have a really curvy vein, you can't guide a catheter through it very easily. So this is basically an injection. It's like getting a shot, and we inject a medicine that's a foam. And what it does is it irritates the walls of the vein and causes it to scar and close down. So pretty easy procedure. You do have to wear compression hose pretty consistently for a few weeks after the procedure, which I think is the biggest challenge of it. The procedure itself is pretty darn easy. It's, like I said, just like getting a shot. So this is another option. Next slide. Phlebectomy is something that we have to do for some of these bigger ropey varicose veins. You can see these pictures here. There's no way a catheter is going through those veins, right? They're so curvy. They're really big as well. So sometimes Verifin is not a good option either. So phlebectomy, I will tell you, the very vast majority of the phlebectomies that I do are outpatient. They are a little bit more involved. So basically what we do is we make incisions, little tiny incisions along the course of this vein, and we pull it out. It's not a vein stripping like what you may have heard in the past. A vein stripping is a lot more involved than this. This is basically, we take out little pieces of the vein at a time. And the numbing part is actually the worst part. And after that, it's just kind of a pulling sensation, which is kind of weird, but it shouldn't hurt terribly. And so you can see the results of that are very good as well. So, and then the last procedure that we talk about, next slide, is sclerotherapy. So, those unsightly spider veins is really where sclerotherapy comes into play. Most of the time, this is a cosmetic procedure, so insurance doesn't cover this unless you have like a bleeding vein or something like that, and then usually we can get coverage. But this is a process of basically doing injections, and we inject a medicine into those veins, and over time we see that the veins go away. And usually, we have to do multiple sessions, usually about 4 to 6 weeks apart. And this is just a picture of a patient who had 3 treatments, and you can kind of see the difference after those 3 sessions. So really, treatment is based off of the vein type, the vein severity, and sometimes we do a little bit of all of these. Sometimes we can just do 1 or 2 treatments. So it all just kind of depends on what we see and what your symptoms are, and that's how we basically decide on how we can help you. Next slide. So that is it. I have rambled on and on and on. If you have any questions, please feel free to ask. I'm happy to answer them for you.
So thank you so much, Jennifer. So I do have a couple of questions that came in.
Okay.
One was about the apple cider vinegar. How does that work? What does it do? I honestly can't tell you, to be honest. I know with the tonic water, it's the quinine. The apple cider vinegar, it's one of those things almost like vitamin D, where there's just so many benefits to it. It's the acid in there that basically, I think it's an acid-base balance in the system, and I think it just helps kind of counteract what's going on. So you'll hear people talk about how they get up in the middle of the night with these cramps, and they'll go drink like pickle juice, right? It's because it has all that vinegar in it. So I believe it has to do with the acid. Okay. And what about the horse chestnut seed? How does that work?
So that, when you look at the studies, they look at we call it the tonacity of the veins, so the way the vein structure works, and it just helps promote healthier shape and size of the vein. It doesn't cure it, but it does help. It basically helps with the flow of the blood. So it helps promote healthier blood flow, which is why it feels better.
Okay. And because you said that's sort of a newer thing.
It's not new. It's just,
okay.
Yeah, it's a supplement that, they've actually done a lot of research on. And there's a couple of there's a prescription supplement that is out there that works in a very similar way, and they've got a lot of studies on as well. It's called Vasculara. The problem, and why I usually recommend the horse chestnut seed over that, is because the Vasculara is usually not covered by insurance, and they offer like assistance on it, but it still ends up being like $50 a month to use, versus you can go to Walmart and spend like $7 on a horse chestnut seed. So,
got it. Okay.
Yeah.
So let's talk a little bit about compression socks. Is there ever a time limit on how long you should wear them during the day? Let's say if you were traveling, do you just wear them when I know a lot of times, because people are worried about a DVT, that they might wear compression socks maybe when they're traveling. But should you be wearing maybe a compression sock all day or not? How does that work?
Yeah, so I think if you have the diagnosis of venous insufficiency and you have those symptoms, wearing it as much as you can during the day is going to be where you get the most benefit. A lot of people ask, should I sleep in it? And we don't really require or recommend that. I have had patients tell me that they feel better when they sleep in it, and I don't tell them they can't, but I have patients sometimes who tell me, you know what, it really digs in around my knee, and after like 4 hours, and I have to take it off. And I'll say take it off if it starts to hurt you. Wearing it the most that you can during the day when you're up and about, or when you're sitting. A lot of people will be sitting at the computer during the day if you're working from home or you're doing things, on the computer. When your legs are sitting down and dependent, it's a good time to wear them. Or if you're going to be on your feet for long periods as well, that's also a really good time to have them on.
Okay, and somebody asked about would compression socks actually get rid of your varicose veins if they wear them? They won't, right?
No, it's a Band-Aid. All it is, it basically just helps kind of get that vein back into kind of more of a normal size, and it also helps augment that calf muscle. So it's just to help with the symptoms. It's not going to make it go away.
Okay, and then what about would your varicose veins come back after you've had a procedure? And if so, how long would that take before they might reoccur?
That is a really good question. So what I tell people is usually they don't come back like the same vein, but could you get new ones? Yes, you could, because you have, if you just look under your skin, you can see all these little green veins under there. Those are all, in your legs too. And so they're all subject to the same stresses and genetic predispositions and all of the things that cause the veins, to have problems. And so what we do know is it's a progressive problem. So we can treat something today, and 5-10 years from now, you may have some new veins that come up, but they will likely be far less severe by treating, the big veins now versus just letting it go. So what I mean by that is we have a huge network of superficial veins in our legs, but there's a couple of them that are really big that we have names for. And when we see those are the big culprit, when we treat those, we eliminate those symptoms, and we significantly slow the progression of any other varicose veins coming, but they certainly could. So, I would never want to promise you the moon and not deliver that. So it's always good to have a really good, realistic understanding. And another question that's really common when you look at like sclerotherapy for cosmetic treatment, that is something, it's like a maintenance thing too, right? Where you treat veins and they very well can pop up in other places. It's just one of those things you kind of just have to keep your eye on with it.
Right, you have to just keep moving it around, right? Okay. Right. I had another question just come in asking maybe compression knee socks versus thigh-high stockings.
Also, very good question. For the most part, the knee high is fine for the conservative therapy. There's a couple of instances where I think a thigh high is a good option. A lot of people have something called lymphedema in addition to their venous disease, and that's the chronic swelling of the leg. And sometimes that can affect the entire leg. And so a thigh high compression helps with that a little bit above the knee. Also, if you have like bulgy veins that kind of cross over the knee up into the thigh, those sometimes a thigh high compression might be a better option for you. People hate thigh high compression because they roll down and they're really hard to get on. I have had some patients who love them, and I think that's great. But the main area that the compression helps is at the calf. So the knee high compression is certainly a minimum and most often all you need, to kind of treat conservatively.
Okay, great. So now I know Pima Heart has a lot of locations. I just want to make sure everyone knows where to find you, Jennifer, if they were interested. I am putting up on the bottom of the screen a phone number that actually goes directly to for an appointment for evaluation for varicose veins. So it's a little bit different than the one in your presentation. It's 520 882-7117. Can you just, I know you're working out of 2 different locations with Pima Heart, is that correct? One is on River?
Right, River and Campbell, and that is the location. We have a vein center. That's where the ultrasound is done, and that's where the procedures are done as well. The IC clinic, we have a vascular suite upstairs in the building. There's 2 buildings there. The 2-story building is where I see patients, and then I also see patients at our La Cholla office, which is basically La Cholla and Orange Grove location. And we have, multiple physicians as well that treat venous disease at multiple locations all over town too. So some on the east side, there's some on the west side. So we have lots and lots of options. So.
Great. Okay. Thank you. That's very helpful. So that is all the questions that have come in today. I want to thank you so much for being here and giving us some options that somebody can use if they've got any kind of venous insufficiency. So thanks again, Jennifer.
Thank you for having me. Everybody have a great day.